listening to Mending Minds from LINNC Online, the podcast where we delve into the latest advancements in research in neurointervention. I'm your host, Dr. Nanthiya Sujijantarat, and in this series, we'll be discussing cutting-edge technologies and their implications on the future of medical treatments. In each episode, I'll be joined by an expert guest who will share their insights and experiences. This program is supported by Medtronic. Let's get started. Hi everyone, on today's episode of Mending Minds, we'll be discussing the topic of chronic subdural hematoma, studies and their implications for future treatments. And for this purpose, I'm delighted to welcome Dr. Jens Fiehler. Dr. Fiehler, welcome to the show.
Thank you for having me.
To start off, would you mind giving us a brief introduction about yourself?
Sure. I'm Jens Fiehler. I'm the director of the Department of Diagnostic and Interventional Neuroradiology at Hamburg University Hospital in Hamburg, Germany. I'm doing this for 15 years now, and my special interest is large clinical studies on neurovascular diseases.
Let's start off with the first questions. Just as an overview, what are the latest advancements in research on chronic subdural hematoma, and how might these studies potentially change current clinical practice?
Yeah, we had a major breakthrough this year with the presentation of 3 randomized controlled trials during the International Stroke Conference in early February this year. They are randomized controlled trials with patients treated surgically versus surgically plus embolization with liquid embolics. And some studies were mixed with patients treated surgically or non-surgically plus minus liquid embolics. And all 3 showed superiority of an extra treatment with liquid embolics.
And what are the important considerations when interpreting the results of chronic subdural hematoma studies and applying them in a daily clinical practice? What are some of the inclusion or exclusion criteria for some of these studies?
I think first it's important to understand that all the patients enrolled were symptomatic. So there was no incidental something. It was really symptomatic patients, and most of them had quite large hematomas. For instance, in embolics, the data were just presented, the average hematoma thickness was about 2 centimeters, which is quite significant. So we are talking about severely clinically affected patients with pronounced hematomas.
And looking forward, what do you see as the future of liquid embolic in chronic subdural hematoma treatment?
I think we need to learn how to apply these trial results, because based on what the local situation is, healthcare system, reimbursement, there will be different view angles on how to apply this in practice. But it's very important to understand that the effect size is very large. So again, the embolization decreased the rate of recurrence from 11.3 to 4.1%, which is a factor 3 almost. And this is very significant for these elderly patients. And it's going to be difficult to apply this in practice, because people will say, okay, almost 90% of patients didn't have recurrence anyway. So why treat all of them with this relatively expensive treatment? But it's way more than just retreatment. It's the hematoma. If it's there, it really complicates everything. From anticoagulations, many patients are under anticoagulation because many are very old, multimorbid. It really increases the suffering and the rate of stroke as a secondary effect and so on. I think that's a relatively complex subject compared to LVO. And this makes it way more difficult to penetrate in the public and in the overall healthcare practice.
What do you think are some of the other research avenues that are worth exploring in the future?
I think what's interesting is also to talk about patients without surgery. So they were included, and for instance, in the STEM study, they drove the effect size of the whole treatment, which is kind of interesting. And then the next question is asymptomatic patients is certainly a subject. And what we are currently doing, and we just presented it during the European Stroke Organization conference, is what is the group with the highest therapy response? And it turns out that the ones who are homogeneous in their appearance and who are more round, not a crescent shape or like a pancake, those are more difficult to treat and have a lower therapy response. But if you look at the round ones, the thick ones, those are the ones who have the highest rate of recurrence and the lowest rate of recurrence with embolization. So this is something we need to learn to increase the effect size.
Now, was there any difference in the outcome when you consider the penetration of liquid embolic during the trial?
We had a very raw and very simple scheme to evaluate penetration, and it didn't show any difference with distal and proximal. We saw also little effect whether there were membranes or not, because the majority had membranes. But we need to look into this deeper, because I just cannot imagine that it doesn't play a role. But so far, there is no signal. But we need to look at this in a more detailed analysis.
Again, might be a function of effect size, like you said.
That's the hypothesis, but so far, it's not a big effect.
And what changes do you think could be made in the pathway to make sure that more patients with chronic subdural hematoma can be captured and treated effectively?
I think it's an education of the medical community about these studies. It's not necessarily very known to everybody, because in general, subdural hematomas are not a very popular disease because it affects elderly people. It's not killing people, and it's not so dramatic like a stroke, which is way easier, or heart attack. So I think to explain better the suffering and what we can do to avoid recurrent hospitalization, and also do some healthcare economic analysis. So for instance, patients with recurrences have more than twice the cost of patients without recurrences. These are a lot of things that we need to look into, and we need to work to communicate this in the public. And this is one step what we are doing here.
And finally, what are the key takeaways that you would like our listeners to remember before we leave here today?
The key takeaways are, we have randomized trials, 3 of them in different geographies, even with different liquid embolics, that also all 3 showed that there is a very substantial therapy effect. And this cannot be disputed. It's nothing that can be discussed. So it's definitely there. How do we translate this into clinical practice needs a bit more discussion, but for the time being, just do it.
You think it will be standard of care?
Yes.
Very soon, right?
And also there are some simulations that have been published on the frequency of subdural hematomas. It could surpass LVO treatment in terms of numbers.
Yeah, very common disease indeed. Thank you so much, Dr. Fiehler, for sharing your valuable insights here today.
Thank you.